Hello, I'm Dr. James Bogash, expert in health and longevity and creator of Bogash Life in Balance. And part of longevity also means not getting chronic diseases and scary diseases like cancer, which puts the fear in everyone. But it is very clear that the choices that we make have a lot to do with whether or not we develop cancer. It's not about blaming people. I think society needs to rise up and point out that the choices we make, things like exercise and sunlight exposure and the diet and the chemicals we're exposed to, all have a role in developing cancer and avoiding cancer. We like to blame genetics, but genetics actually play a really small role in cancer. People don't want to hear that, but it is the reality of this beast that we face. I think part of it is that people think that if we get cancer, we're going to be okay because we can treat it. And yet, when you look at cancer, still number 2 death, generally heart disease, which is completely preventable, remains number 1. Cancer still is number 2. So we're not doing a good job at fighting this off. Some of the cancers we do well with, most of them we do not. And the treatments that we have available it's a little sad when you start looking at it and the games that are played with your life and your dollars in mind, because cancer treatment is not cheap. And so you think that if you're going to be given a drug, that this drug is going to be proven to be effective, but that's not necessarily the case. 2 studies I want to point out here. And first thing we need to talk about is something called overall survival versus progression-free survival. Overall survival means you lived longer. In that realm, it also depends on how long you live. Did you live a month longer? Did you live 5 years longer? So overall survival and how long that is important. Progression-free survival is what we call a surrogate end marker, which is never a good. We use surrogate end markers to get a drug to market faster. They're like, hey, if this drug can, stop your hair from falling out, then obviously I didn't use it, but then maybe it will also help protect your heart because there's some links between it. It's just a ridiculous way of finagling the data and getting drugs to market faster. It doesn't mean that they work better. So overall survival versus progression-free survival, a lot of cancer drugs are approved on progression-free survivals. So when the first study I'm going to looked at cancer drugs in phase 3 cancer trials. And how many of these, so phase 3 is a drug that's gone through phase 1, phase 2, and is now being compared to standard drugs that are already being used, and seeing how well they work versus those other drugs. And during a period of time that the researchers looked at it, there were 187 drugs, 131 of these drugs being tested. So 80% of them failed to show any benefit. The remaining 56, 33 of them showed no additional improvement. You better believe these drugs were probably more expensive, maybe more side effects. The bulk of these drugs in phase 3 cancer trials didn't either help or didn't help additionally above and beyond what was already being used. It's a pretty sad state of affairs, and I'm going to end this video with what we need to do about that, because obviously the system's broken. It's perpetuated, it's moving forward. Every time we donate money to a big cancer organization, rarely are we improving overall survival. We're just throwing more money at the problem. So by the time something gets to phase 3 clinical trials, the drug companies spent a lot of money, and they get these monies from grants and foundations and things, but they're not. Now, obviously, the system is broken. It produces very little benefit for the massive amount of money we throw at it. So then what if a drug does get approved and makes it through? This was a study looking at 33,348 patients, so just a little over 37,000 cancer patients over the course of 7 years, from 2008 to 2018. And what they looked at was 44 brand new shiny drugs that were used. Of these, only 11 of them had shown a benefit in overall survival. The other 33 may have improved progression-free survivals, but didn't actually make people live longer. But you better believe they were more expensive. In 2011, about 13%, 12.7% of these drugs were used with no benefit. By 2018, that number had jumped to 58.8%. Almost 68% of the drugs used on these patients, these shiny new drugs, had no real benefit, but they were used for these patients. Unfortunately, these are probably not conversations that were had by the oncologist and their patients. We're humans. We want to we want to give people hope, but sometimes the answers aren't where they need them to be. Of the 11 of those that had overall survival benefits out of the 44 shiny new drugs, the average overall survival was 4.6 to 6.6 months, like not really extending lifespan. So the big picture, and none of those drugs actually improved quality of life, or at least they weren't shown to improve quality of life. So it's a mess, and it's not getting any better. We throw a tremendous amount of money, and maybe the system's broken. Maybe we need to look at things like ketogenic diet. Maybe there are plant-based compounds that we need to use, should be looking at. Exercise. Our approach to to cancer is to find a drug that's going to destroy it, and we are seeing that this is a very poor choice, and we waste a tremendous amount of money. In the study on the 37,000 patients, it was $1.8 billion of drugs that were known to show no benefit, but were still used. So I really think things like the ketogenic diet probably is one of the more powerful tools that could be used. We certainly have enough studies, but these aren't the direction that we're throwing all the money at. It's sad. It's the state of affairs. And it always boils back down to what I say is prevention is always best, making the right lifestyle choices in the front end so you are not faced with that decision about using a drug that might not show a benefit. As always, I'll post a link to this particular studies in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.